Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, I'm so excited. Recently, we've been talking all about our Gold Midwifery Online Conference 2026, and you can head over to the website right now to get all the details on this presentation that we're going to be talking about in a minute. So it's goldmidwifery.com, and then all the details of the up and coming live events. So I'm delighted to say that I've got Abigail Corbin here with me today, and she's going to be speaking live at our event. And some of the advantages that you could say is that you can come in and enjoy that real experience of interaction with fellow midwives and birth workers. And then, of course, Abby will be here with us talking in the live Q&A after the presentation as well. So welcome to you, Abigail. It's great to have you here today.
Thank you. I'm so glad to be here.
And you're going to be talking about bridging the postpartum gap, addressing long-term risks after gestational diabetes. Now, this topic to me, again, we were talking just offline. It's something that is coming up over and over. I feel like there's many gaps. I mean, you said the postpartum gap. I just feel like there's so many gaps after actually, having a client recently. So I can't actually wait to hear, as you get into it. But I want to get into kind of a little bit of your sort of how this, came around for you. So tell me a little bit about, you've worked in leadership, midwifery education, research. Can you share a little bit about what first drew your attention to this particular topic, and especially what happens or doesn't happen for families in that postpartum period?
Yeah, absolutely. So I had a moment a couple of years ago where I'm a midwife, had been practicing for 16 years at that point, and
Mm,
had moved into a management position in a hospital and was managing the adult diabetes program in Ontario. And I remember talking to the nurses and dietitians about gestational diabetes and having this aha moment where I realized that my knowledge as a midwife was actually not that strong. And
mm,
that even though I've been supporting women for many, many years with gestational diabetes, I hadn't really engaged with it as a topic and
right.
recognized that I don't think that's unusual for midwives, particularly if you're in high resourced areas. We might have an
Hmm.
endocrinologist or a clinic that's taking care of the diabetes. And so that sparked my interest in learning more about it, and also what the role of midwives can be in supporting women and gender diverse people with gestational diabetes. Like we said, I have an academic background as well. So I worked with
Hmm.
master in their midwifery leadership, midwifery master's program, and we created a diabetes course for midwives. And again, it was so fun to create this course, to be able to engage with midwives and to understand that there is so much more to gestational diabetes than just saying, oh, your sugar is normal. And that would have been the extent
Right.
of my discussion. And there's a real opportunity when women are aware of the risks, when they are supported, when they think ahead to the birth and postpartum period, that outcomes can change. And midwives are great at that, right? Like the model of
Mm,
midwifery really is about education, about putting the person in the center of their care, having the
right.
time to have these conversations, talking about, okay, the baby's birth is coming up. How can we help you be successful? They say breastfeeding is your choice. And so, yeah, I would distinctly remember that moment of thinking, I don't think I know as much about gestational diabetes as I should as a midwife,
Right.
and really trying to learn from there.
Yeah. Well, I love that. And it is very exciting to have those educational modules. And, thank you for jumping on that. I mean, you know how we see things in practice and we're like, what's going on? Why is there
Mhm.
such a gap here? So clearly still some more work to do. And I know that, when working with families, they often get close monitoring during pregnancy,
Mhm.
followed by that sharp sort of drop off at birth. And we talked about that before. So from your experience, can you just share where are families most at risk of falling through the cracks after, a gestational diabetes diagnosis?
Yeah. Well, I think it really is the moment of birth. I have this distinct memory of my first child who was born premature, had a ton of people in
Hmm.
the room for my labor. She was born, went off to the NICU, and I was all of a sudden sitting in a room that was completely empty. And I think
Right.
that's just a great demonstration of the focus that we have on pregnancy. Really, the focus is on the baby. You manage your blood sugar so that your baby is healthy, and then the baby's born, and our entire focus then goes to the baby.
Hmm.
And women, I think, are also really wanting to be good mothers, and they're trying to take care of their families. And unfortunately, what happens is their own health can take the back seat. Uh,
Right.
we know postpartum care can be there can be a lot of gaps in postpartum care. Of course,
Hmm.
I'm biased in saying this, but especially if you don't have midwives, right? Like, and
Right.
midwives really, at least in Canada, are just for the first couple of months.
Hmm.
And then again, the focus is the baby growing, are they feeding? And we forget that this person who's just delivered, who had this gestational diabetes, really is at a crossroads in their own healthcare or in their own health,
Mm.
because it's an opportunity for them to know what's happening in their body, that they are at risk of developing type 2 diabetes, and
Hmm.
working on how can they prevent that, how can they make these healthy decisions, how can they integrate more health for themselves. But it's at a moment in their life when that's really challenging. And I don't think that families get enough support to make those decisions, to be supported in those decisions, to really understand the implications of that period on the
Right.
rest of their life. Yeah.
Yeah. No, you can see, yeah, there's a lot that needs to happen in that area. And I think this is why this topic is so important. And it's particularly from your session, I know that for a lot of people, this will be like a big jumping off point or a point of turn, in what they know or what they're going to do next. So that's what excites me a lot about it. And I know your session looks at that sort of evidence-based strategies from, breastfeeding lifestyle and, newer
Mhm.
pharmacological options. But I'm going to put you on the spot because I know a lot of people will be thinking about this in real world terms. And of course, you mentioned you're in Canada, right? We talked about this international platform. So how can midwives like realistically support long-term health while navigating time, system, and perhaps resource constraints as well? Um,
Mhm.
is there something that you've seen insight as you've been studying this that can still just, they can take advantage of?
Yeah, it's a couple of thoughts. One of them is, it's if you're only talking about it postpartum, it's too late. The opportunity for midwives is prenatally to start having those discussions about the impact on this person's lifelong health.
Right.
Depending on the resources of that person, they may not have a primary care provider, they may not have follow up after they've been with you. And they may not have, even if they do, that person may not bring up those discussions about, like, okay, what are we going to do here for you?
Mm-hmm.
And so my first point is midwives need to be having discussions prenatally around the lifelong implications of having gestational diabetes. The other one is midwives are really well suited to support people with GDM postpartum because of the nature of midwifery, where we are patient, we're client centered. And when you look at the evidence for what works, it's really around um, human design thinking. It's around having a program that people design themselves, right? It meets them where they're at, where you can engage with them, because it's going to look different in different places. There's no
Right.
evidence shows this. There's no one right way, or else we'd all be doing it. It's really about how do you provide care in the context of where you are, and how do you know
Yeah.
that? It's by listening to people. We need to
Mm.
listen to women to say, okay, what do you want? What works for
Mm-hmm.
you? And then the last point is around building community.
Mm.
A lot of the research found things that, like, support groups, ability to build community can be quite effective. And I think that aligns well with other needs that women have postpartum, where they need community, they need mental health support. And so, how do we do that in a holistic way, where we're not just meeting the needs of their diabetes, but also their need for community, their need for positive mental health as well?
I just love that. And I feel like you just answered part of my final question for you. Because I think this is it's I mean this is the future. This is what we're looking at. This is the ideal, of course. And I think we can all agree that, midwifery care is one of the best models for preventing chronic disease.
Yeah.
But also, advancing equity and all those types of things. What are you hoping that folks will take away as part of your presentation and your session?
Yeah, I love the question. Thank you. I'm hoping people feel more confident in how to provide care for GDM.
Hmm.
in the sense that they want to engage with it, right? Like you're not going to
Mm.
leave this 1 hour talk and be like, I know everything there is about GDM. I can now provide care. But I hope to whet people's appetites to engage in it and to become more confident. The rates of GDM are going up across the world. We know
Right.
that. And there's a real opportunity for midwives to, if they are confident, if they do see themselves as experts, to start having seats at the table. That
Mm.
is what I would wish for people coming out of this talk is, yeah, I do want to be involved and I want to lead this. Midwives are so well suited to lead innovation, to lead patient-centered care. And that's what we
Yes.
need right now. As we're looking at a global epidemic of diabetes, it should be midwives that are leading the calls, that are having seats at the table, that are on all of those, committees, and the people that can shape guidelines, the way we provide care. I really hope that midwives see themselves as the leaders in that care.
That is fantastic. All I wanted to say was yes, yes, and yes to that part. I think that, yeah, we need this boost. And, you and I were talking about, how this is tied into leadership. You are an amazing leader, Abigail. Thank you
Thank
so
you.
much. Taking us on this journey, I think is going to be so important, looking at those gaps, how we can play a role in that, not just putting it into practice, but what we can do in our communities as well. Thank you so much for being here today. It's been
Oh,
wonderful chatting with you.
thank you for having me.
Amazing presentation coming up. You can head over to goldmidwifery.com right now. Check it all out. You can look at your local time zone. Do come and join us for this really important conversations. We want to hear how you feel about this. What do you see in your community? How can you expand it? Bridging the postpartum gap, addressing long-term risks after gestational diabetes. Thank you so much once again to Abigail Corbin for being with us here today. And of course, to all you, our listeners, we appreciate you. We'll look forward to seeing you online. Bye bye for now, everyone.